Hi, I'm Rosie. I'm going to be teaching you how to suction a trach properly. So the first thing you want to do is make sure you provide privacy. If there's another patient in the room, you want to close that curtain, close the door, and of course come in, hand hygiene, introduce yourself, and verify that you have the right patient. So, hi, Mr. Smith. I'm Rosie. I'm going to be your nurse for today. Can you tell me your full name and date of birth, please? Wonderful. Now I'm going to just check your wristband here. Name and date of birth match. Perfect. So I'm going to do, I'm going to suction your trach, and so we can get some of that airway cleared out. Is that okay? Okay, wonderful. So we lift the bed up to a working height and have the patient in the semi-Fowler's position. So first thing you want to do is gather your supplies. So inside the sterile kit, here we have sterile water. I brought a towel just in case, because we don't want to get water and secretions all over the patient. And we have a suction catheter kit. So inside the kit, it has a suction catheter, vinyl gloves, so sterile gloves, and a pop-up cup that we're going to use to put the sterile water in. So you also want to make sure that your suction is on. You want to have it between 80 and 100, so intermittent suction or regular. And you have suction tubing connected to the canister. This is where the secretions will go once we suction the patient. So first we want to lay the towel on our patient just to make sure they're covered. And then we'll go ahead and open our catheter kit, suction kit. So this maintains sterility at all times. So first we want to don our gloves in order to keep the other supplies sterile. So we don our gloves. It's okay to touch the outside. 1 inch will still maintain sterility. So now we are going to grab our container that should be sterile. We open that up. And this hand will no longer be sterile. So try to do it with your non-dominant hand. And we would open our sterile water, bring some in. Bring this closer to us. And with our other hand, now this field is still sterile, so we can bring out the suction tube. Bring that forth, use your non-sterile hand to grab the suction, connect while maintaining sterility with your dominant hand. So you want to test it to make sure you can hear the sound and that the suction is connected properly. Okay, I'm going to go ahead and insert the tubing now, okay? It's okay to cough. Let me know if you need me to stop at any time. It might feel a little uncomfortable, okay? So you insert the tubing. And once you meet resistance, you'll know that that's where you need to stop. So as you pull out the tubing, you want to press the suction intermittently as you're pulling out. Don't press the suction when you're going in. So as you're going out intermittently, over the span of 10 to 15 seconds. If you need to clear the tubing from the secretions, suction some of the sterile water. Be careful to maintain sterility. And you wait at least 30 seconds in between suction. So now that it's been 30 seconds and it sounds like they might need another round. So let's go again. Don't touch the trach with your hands. And you go in again until you meet resistance. Intermittently suction with a span of 10 to 15 seconds, so try not to go too fast. Okay, and then we repeat until the lung sound better, or the patient tells you to stop. So, okay, so we're done. How are you feeling, Mr. Smith? Yeah, can you breathe better? Okay. Remove gloves, hand hygiene. And clear this out. Lower the bed. Place it back to a comfortable position for the patient. Okay, and here's your call light. You can call me if you need anything, okay? So at this point, I would reassess lung sounds and document. So once everything is cleared up, of course. So then we document that this is a 14 French suction catheter that I used on the patient. Patient tolerated it well. I would document the amount of secretions. If there's any blood or whatever color came out, we document that as well. Document lung sounds, oxygen, and patient tolerance overall. So make sure bed rails are up for safety, and we are done.